Let us begin by observing normal respiratory mechanics. During normal breathing, air flows freely through the trachea and branches into the bronchial tree. The diaphragm contracts smoothly, expanding the thoracic cavity and allowing the lungs to fill with air. The airways remain fully patent, facilitating optimal oxygen exchange without any resistance. Now, let us observe the development of asthma. Asthma is a chronic inflammatory disorder of the respiratory tract. Over time, exposure to environmental triggers or allergens causes the inner lining of the bronchial tubes to become chronically inflamed and highly sensitive. This state of hyper-responsiveness sets the stage for airway compromise. Even outside of an acute exacerbation, baseline asthmatic breathing is fundamentally altered. The chronic inflammation permanently narrows the airway lumen slightly. Because the passage is restricted, the respiratory muscles must work harder to move the same volume of air, often resulting in a prolonged expiratory phase. To understand an acute attack, we must zoom in and compare the bronchial structures directly. In a normal, healthy airway, the smooth muscles surrounding the bronchioles are completely relaxed. The inner mucosal lining is thin, and the airway remains wide open, providing an unobstructed path for airflow. In an asthmatic airway, the pathology changes dramatically. Notice the smooth muscles wrapping around the bronchioles. They are tightened and hyper-reactive. The mucosal lining is visibly swollen due to underlying inflammation. Furthermore, the tissue begins to secrete excess, thick mucus. This combination of tightened muscles and mucus accumulation significantly reduces the diameter of the airway. Because of this underlying baseline constriction, the patient remains highly vulnerable to environmental triggers. The persistent airway inflammation means that even mild irritants, such as cold air, pollen, or emotional stress, can provoke an exaggerated immune response. This chronic state requires careful daily management, often utilizing inhaled corticosteroids to keep mucosal swelling and mucus production under control. Finally, we observe an acute asthmatic attack, triggered by an irritant. A sudden and severe spasm of the bronchial smooth muscles occurs. The airway constricts drastically, and a sudden surge of excess mucus plugs the remaining opening. This severe bronchoconstriction traps air in the alveoli, creating acute respiratory distress that requires immediate pharmacological intervention to relax the smooth muscle and restore the airway. For anesthesia providers, recognizing this hyper-reactive pathology is critical, as induction and intubation can easily trigger a life-threatening perioperative bronchospasm. Save this airway breakdown for your clinical reviews, and follow Mr. Medico blogs for more.